The Association of Philippine Medical Colleges Student Network, Office of the National Vice President, APMC-SN Luzon, APMC-SN Visayas, APMC-SN Mindanao, and APMC-SN National Capital Region Southern Luzon present you PinaSiglaTV, Health Education Brought Closer.
PinaSiglaTV presents Episode 3, Mental Health.
Oh no! Another failing grade again? I feel worthless and a disappointment to my family. Hello, Uncle Ray. Sorry for calling you this late.
Oh, hello Trisha. What's going on?
I want to open up something that keeps on bothering me. Maybe you can help me since you're a psychiatrist.
Alright then, go ahead. I'm listening.
I feel anxious and scared on how mom and dad will react. I just received my grades and they're not that good. To be honest, I get unmotivated with my studies. I want to give up. I'm really tired and I usually forget to take care of myself.
Okay. Tell me more.
I've been having difficulty talking about my feelings. I'm afraid that people will judge me. That's why I keep my problems to myself.
Well, I'm glad you opened up, and I understand. Is it okay that I'll discuss mental health? Then we'll figure out how I can help you.
Yes, that would be great.
The World Health Organization, or WHO, defines mental health as a state of well-being, in which one realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to contribute to his or her community. It's an integral part of health and should not be ignored. Mental health conditions are rising worldwide. These include depression, bipolar disorder, and a lot more. An estimated 20% of the world's children and adolescents suffer from a mental health condition. In early 2020, WHO reported that at least 3.6 million Filipinos suffer from one kind of mental, neurological, and substance use disorder. In the Philippines, there are only 60 mental health facilities, only 7% hospitals have psychiatric wards, and only 2 mental health workers for every 100,000 Filipinos available. A lot of people are overwhelmed by their fears and anxieties because of the pandemic. Mind Nation said that 2 out of every 25 Filipino employees are at risk of suicide, and that COVID-19 fears are the primary source of suicidal ideation. UNICEF published the State of the World's Children 2021, and it shows how this pandemic and its health control management, such as lockdowns, affect the mental health of children and adolescents. Mental health stigma is when a society discriminates against people who lives with mental illnesses or asks help for emotional distress, such as anxiety and depression. It has become part of Filipino culture, and it affects the lives of the people suffering. They avoid treatment, isolate themselves, develop low self-esteem, are unemployed, and a lot more. Due to lack of awareness and knowledge, stigma still occurs. That is why it is important that mental health advocacy and education must be strengthened, especially in the community. WHO says that mental health is more than the absence of mental health disorders or disabilities. It is as important as our physical health. Poor mental health is linked with stressful work situations, gender discrimination, social exclusion, unhealthy lifestyle, and others. Here are the possible consequences if mental health concerns are not being addressed. Conditions will worsen. Mental illness and chronic stress are linked to higher risk of developing different medical conditions, such as diabetes and heart problems. Decreased personal relationships, such as being isolated and losing friends. Difficulty coping with daily living activities, such as attending work or school. Increased risk of substance abuse, and suicide. Mental health should not be ignored, which is why we must take care of ourselves. Your mental health matters. Talk about your feelings. This may help you deal with the problems that have been bothering you. Keep active. Exercise may help improve your self-esteem. Engage in hobbies you enjoy, like painting or gardening. Stay in touch with your loved ones. Give yourself a break and don't be afraid to ask for help. It's okay to not be okay. There's nothing wrong with seeking help from professionals. Raising awareness on mental health is challenging, but it is possible. To support mental health and break the stigma, we can do the following. Discuss mental health openly. Educate ourselves and others on mental health. It is important to check the correctness of the information. Don't forget to share the info. Let's be conscious of our language. Avoid using hurtful words. Be compassionate to people suffering. Normalize seeking mental health treatment. And speak up against the stigma. Republic Act 11036, or the Philippine Mental Health Law, was passed last July 21, 2018. This law was passed to strengthen the mental health service delivery to universal healthcare by promoting and protecting the rights of individuals through providing psychosocial health services and improving mental health resources. There are various organizations offering mental health services. I'll send you the list of their hotline numbers. Mental health must be taken seriously. It's okay to ask for help. Your feelings are valid, and remember, you are worthy. Let's work together and break the stigma.